Okay, so osteoarthritis, you got the wearing away of the cartilage between your bones. So when you walk, your knees grind or your hands. Let's look at standard operating procedure. If you've got osteoarthritis, what do? Well, we go to our doctor, right? Let me show you the process that takes place, hopefully to prevent you from going through this, or if you know someone who has arthritis, you may want to show them this video so that they can confirm this process, and then perhaps you can avoid it and maybe we can help them. But here's what happens when you get a pain in your knees that's constant. It like gets to unbearable. You go to the doctor says, what? Oh, wow, man, look, you just got arthritis, man. It happens to everybody. You get older, you wear away the cartilage in between your bones. I got you. Look, just take a good old NSAID. You can go to your pharmacy. I'll give you some of these I got here, the extra strength or whatever, just to get you started. And then you lose some weight and you're probably helped. So you take your non-steroidal anti-inflammatory drug, feel great, right? Got rid of the pain, everything's good to go. Now, your non-steroidal anti-inflammatory drugs, what he didn't tell you, your aspirin, Advil, Motrin, things like that, they have side effects. As a matter of fact, they are the #1 cause of liver disease. Not alcohol, incense. So your non-steroidal anti-inflammatory drugs. What are the side effects that they mainly cause though? Stomach pain, digestive issues, ulcers, nausea, constipation, dizziness. Well, let's say that you don't get all the side effects, because nobody's really going to get all the side effects, right? Everybody takes this stuff. So what if you just get one? Let's say you get an ulcer. Go back to the doctor, right? Doctor says, yep, this happens quite frequently. He doesn't tell you that it's what he put you on the first time that caused this ulcer. But no matter now, because you got the ulcer. You got to get rid of it, right? So what do? He puts you on a PPI, a proton pump inhibitor, which is one of the many things he could put you on, but that's the most likely. So proton pump inhibitors are Curus, Prilosec, Prevacid, Protonix, Nexium. Now, what he doesn't tell you also, yeah, they work. You won't feel the ulcer anymore. You won't have any pain. You won't have any heartburn. But what could happen is you could get kidney disease, liver disease, heart disease, dementia, endocrine tumors of the GI tract, respiratory infections, poor nutrient absorption, because what does proton pump inhibitor do? It inhibits the pump that releases the acid. The acid is what breaks down our food. Well, now you have poor nutrient absorption, which means a vast array of different disorders can happen because you're not getting the good stuff out of your food. You get the calories, easy. Nutrients, not so much. So now what happens is, you go and the doctor tests your blood after, a while, and you go for your routine checkup, whatever, and boom, all of a sudden you got heart disease. Now he doesn't tell you that the reason you got the heart disease is from the proton pump inhibitor that was from the non-steroidal anti-inflammatory drug he gave you. So he's like, man, easy fix. Got you covered. Got you some blood pressure medication right here. And how about some cholesterol medication? Keep your cholesterol low because that's really important for your heart. We wouldn't want your lipids to get out of line for any reason. So now he gives you Voltaren, which is one of the main blood pressure. It's an ARB, is its action. Now, the side effects there are kidney disease, liver disease, viral infection, erectile dysfunction, fatigue, headache, hair loss, low blood pressure. But let's just say you get one of the many side effects you can get. Oh, and the cholesterol lowering drug, lovastatin, So now the statin drug side effects are muscle aches, swelling, cramps, liver problems, central nervous system issues, digestive problems, skin problems, bleeding, flu-like symptoms, memory loss, confusion, fatigue. Oh, dang. So now you're on an NSAID, a PPI, a ARB, and a statin drug. And let's just say you got one of those from this. How about you got a fatigue from your ARB, and then you mess around and you get, well, you're already confused because you would have quit this if you weren't confused. Let's just say that you get one of these digestive issues, which you already had from the PPI to begin with. Well, then this strange thing happens too. You're going back to your doctor, but it's because the NSAIDs are not working. You have developed a tolerance to them, and your knees have gotten worse because he didn't rebuild anything. He just numbed the pain while you kept walking and running and dancing and doing whatever. Now you got real problems. So he says, look, we can't put you on a corticosteroid because we already jacked up your heart, and we know that corticosteroids actually increase your risk of heart disease dramatically, hardening of the arteries and all kinds of cool stuff. So we don't really want to go with that, so we're just going to put you on the opioid painkiller. What can go wrong there? So now you put you on hydrocodone. He's like, this is not one of the worst. I mean, there's definitely worse ones like Oxycontin, which you'll need later. Before we do your knee replacement, but for now, just take a little bit of this hydrocodone with some acetaminophen with it. You won't need the NSAIDs anymore. We'll do away with that. So now you got nausea, constipation, dizziness, addiction, low blood pressure, weakness, low back pain, liver disease. Now, this one has liver disease. That's 1, 2, 3. If you're taking 4 medications that cause liver disease, you know what you might end up with? Liver disease. And you got 1, 2, 3 of them that cause nausea. Bet you get nauseated. Constipation's 1, 2, 3, and you ain't got but one that causes erectile dysfunction, but that's enough because most people that take blood pressure medication get ED. Which he can give you something for that too. But then what happens after you get addicted to the opioids, right? You get addicted to those, you go back, you just want more. I mean, you really, your pain's coming back, you think, but it's not really coming back because you've been numbed, and you just want more opioids. So then he has to up your dose, and he says, why don't we talk about just cutting that knee out and putting a new one in? Well, we don't want to talk about that because, hell, I got a friggin' ulcer from the NSAIDs that I'm still taking because I was hurting. On top of my painkiller down here, I got my proton pump inhibitor that's done gave me high blood pressure and high cholesterol, along with those two giving me all kinds of disorders, and then causing me to go back. Now I need more hydrocodone. It doesn't stop. That's the point. They keep you sick and coming in, not telling you the cause of your sickness. You ever notice whenever you watch those commercials, they don't really know how the drug works, what action or mechanism causes it to work, and they don't really know the cause of your disease because they only treat the symptoms of your disease. For if they found the cause, they could change the effect, and they wouldn't have a job. So they think. So, name one disease they've cured in the last 60 years, a degenerative disease, a disease where your body is wearing out. Perhaps it's because you can't cure an organic body with a synthetic drug. Now, that leads us to this. What if, when you got osteoarthritis or joint pain, you decided, hey, you know what? If my body is made up of vitamins, minerals, amino acids, fatty acids, simple sugars, protein, water, and air, what if I got it, whatever it's missing? What do you think would happen? Right there in the beginning, if you would have started taking some Ultra Joint Health with some MSM plus C, MSM plus C being proven more effective than your pain medications at relieving joint pain with none of the negative side effects, as a matter of fact, a whole lot of health benefits, and Ultra Joint Health having the raw material that the body needs to rebuild cartilage at a cellular level, sometimes at the rate of 1/4 inch in 6 months. Now, you could have had more energy, relieved of the pain, rebuilt your knees, put elasticity in your arterial walls, making you less likely to have heart disease. You could have rehydrated your cells and your body with MSM. You could have lubricated your joints like a WD-40 instead of going through all this crap. That's the difference in proper supplementation with good nutrition as opposed to medical profession and treating symptom. See, the body likes to heal. It likes to be healthy. It wants you to stay in homeostasis. In other words, it does not want you degrading. It doesn't necessarily want you to improve, but it sure as heck doesn't want you to get worse. But if it cannot maintain the cellular reproduction because it doesn't have the right raw materials to rebuild, you end up with degenerative, meaning degenerate, to wear out, disease. Osteoarthritis is one of them. Heart disease is another. Cancer is another. But if you give the body those raw materials, the body rebuilds. And they call it, either they say that they misdiagnosed, which I think is hilarious whenever people go in to get their double knee replacement surgery, that they don't need magically anymore. And the doctor says, well, we must have misdiagnosed because we know it couldn't be anything else. But if I am given these two options, anywhere in this, try that. Try it for 6 months. You got a 100% money back guarantee on it. If it don't work, we'll give you your money back. It comes in a 2-month supply. Just get Ultra Joint Health and MSM. If you have acid reflux, indigestion, heartburn, hiatal hernia, get the MSM powder. If I'm wrong, you get your freaking money back. If I'm right, you get 10 more years of life without pain, playing with your kids and your grandkids and having fun, lifting weights and running and having sex because you don't have erectile dysfunction from the freaking blood pressure medication. Just being as honest and upfront as I can. If you can't tell by now that your medical profession is a bunch of lying thieves, well, then you probably don't need to stay on my channel. Because with this whole pandemic going on, y'all, it's quite evident that they do not have our best interest at heart, nor our children's. Go to newsarms.com, check it out. We got stuff for everything imaginable, from autoimmune disorders to cancer to diabetes. If there is any way I can personally help you, my name is Seth Williams. My telephone number is 256-497-0494. You can call the store at 256-757-0660. Newsarms.com, NEWSARMS.com. Check it out. You really don't have anything to lose. If you have questions, email me or text me, and I will do my best to help. If I don't know, I'll tell you. I'll be like, I don't know, dog. Like, we need to go figure this out. Like, why don't we call somebody that's smarter than me? But for the most part, I'm here to serve you. If I'm not a doctor, I've seen a 70-year-old man grow a 1/4 inch cartilage in both his knees and not have to have knee replacement surgery. I'll give you your money back if it don't work. What the hell do you want? So you can keep doing things the way that they've been done, and you can have the same disorders, diseases, and die like your parents did. Or we can try something different. I've found that the Creator, God, is rather intelligent. And when we give the body what He intended for it to have, things go well. When we try to heal an organic body with a synthetic drug, things don't go so well, as you can see. The side effects to Ultra Joint Health and MSM are better joints, better hair, better skin, better nails, more energy, lubrication of all your joints, putting elasticity back into the arterial walls, faster healing. Those are your side effects. Not stomach pain, indigestive issues, ulcers, nausea, constipation, dizziness, kidney, liver, heart disease, dementia, endocrine tumors of the GI tract, respiratory infection, none of that crap. Like, that's why you do natural. You do not have to take something dangerous to heal. To think that side effects mean effective is ignorance. You don't have to hurt to heal. Now, you will go through a detox perhaps with these products because they're so potent. But that doesn't mean you have to hurt. It means you shouldn't have them toxins in you. So anyway, check us out, newsarms.com, if there's any way I can be of service. That's what I'm here for. Love y'all.